Layering the concept of dysgenics onto the reality of Black America reveals a stark contrast. When applied to Black communities, the traditional premise of dysgenics that a population is suffering a genetic decline because lower income families have higher birth rates fails to hold up under real world data. Instead, it exposes a different pattern: structural compression. 1. The demographic reality. The core assumption behind classic dysgenic theories that lower income demographics drive continuous high population growth is contradicted by current demographic data. Declining total fertility rates. Black birth rates in the U.S. have dropped to historical lows, dropping to around 1.5 births per woman. Black Americans across all socioeconomic levels are having fewer children due to economic pressures, rising costs of living, and shifting life priorities. Higher education and delays. Highly educated Black women are delaying marriage and childbirth at rates similar to or higher than their peers, reflecting national economic realities rather than a unique internal trend. 2. Genetic determinism versus epigenetic realities. Applying a purely biological lens to community challenges overlooks how environmental factors physically affect human health across generations. Structural environment to epigenetic and health burden, to biological impact, industrial proximity, elevated cortisol/stress, high maternal mortality, red line neighborhoods, lead and toxic exposure, chronic disease risk asterisk epigenetics, the real biological layer. Chronic stress, historical trauma, and exposure to toxic environments alter how genes express themselves without changing the DNA sequence. This field shows how living in high stress, polluted environments directly impacts health outcomes across generations. Maternal mortality disparities. CDC data indicates Black women face maternal mortality rates roughly 2.5 to 3 times higher than white women, approximately 44.8 deaths per 100,000 live births. This outcome is driven by bias in clinical care, unequal access to quality medical resources, and chronic stress rather than genetic flaws. Environmental pressures. Industrial facilities, waste sites, and heat islands remain disproportionately located near majority Black neighborhoods. Over generations, prolonged exposure to lead, fine particulates, and industrial pollutants causes measurable cognitive and cardiovascular strain. 3. The socioeconomic trap. If we define dysgenic not as biological inferiority, but as a system that actively degrades human health, wealth, and potential over time, the primary driver is structural inequality, systemic factor, intergenerational outcome. Racial wealth gap limits capital transfer, preventing families from passing down property, business, or debt-free education. Institutional stress. High exposure to systemic friction elevates baseline stress levels, accelerating biological aging and increasing susceptibility to disease. Underfunded infrastructure. Inadequate public services and unequal access to health care restrict opportunities to build long-term wellness. The bottom line: evaluating Black life in America through a traditional dysgenics lens misdiagnoses the situation by treating environmental and political outcomes as biological flaws. The primary challenge facing Black communities is not a decline in genetic potential, but the ongoing impact of environmental, economic, and social pressures that place artificial limits on human development.